Good morning, and thanks for joining us on our Facebook Live today. I'm Kelly Hawkins. I'm the Public Information Director for SRHD, and today I am joined by Kirsten Duncan. She is a health program specialist here at SRHD as well, and we're here to recognize STI Awareness Month and talk about some of the local trends that we're seeing and those that are concerning, and talk about how people can help support prevention, testing, and treatment in our community. So, hi, Kirsten.
Hi.
Thanks for joining us.
Thanks for having me.
Maybe we can start off by just talking about some of the STI trends you're seeing and those that are most concerning with you.
Yeah, so our most commonly reported STIs in Spokane County are chlamydia, gonorrhea, and syphilis. And thankfully, we've actually been seeing a decrease in the rates of these infections over the last couple years. So gonorrhea and chlamydia are down around 12% from 2024 to 2025, and syphilis is down 20%, which is great. And we think that some of this might be due to the use of DoxyPEP, which is a new STI prevention tool that's been out for a couple years. But we are seeing some concerning things. So we continue to see higher cases of syphilis in pregnant women and infants, which is really tragic. Mm-hmm. And that tells us that women are not getting tested for syphilis as often as they should be before they get pregnant. Mm-hmm. We're also seeing more cases of late syphilis. So people diagnosed with syphilis after they've had it for more than a year, which means we suspect there are a lot more people that have been exposed to syphilis than we really know about in our community. And the last thing we're seeing that's a little concerning is higher numbers of cases of complicated syphilis. So things like neurosyphilis and ocular syphilis, things that can cause permanent damage to folks such as loss of vision, hearing, stroke, and nerve damage. So really, really sad to see some of those things still happening.
Yeah, we could talk for hours probably about some of those concerning and how syphilis is such a strange illness to have. And what barriers do people face in Spokane when it comes to STI treatment, testing and treatment, and what does our team do to help with some of those barriers?
So barriers to sexual health testing are similar to barriers to all other healthcare services. Cost, transportation, the time and availability of medical appointments can be really challenging for folks. We know that there's a lack of access to primary care in our system, and so a lot of folks are going to urgent cares or emergency rooms for STI testing, which means they might not be getting a really thorough sexual history exam and getting that continuity of care that's really important with STI testing, treatment, and follow-up. And with sexual health specifically, we definitely see barriers around finding a provider that you feel comfortable discussing your sexual health with, and folks feel a lot of stigma when going to a healthcare provider and talking about sex, talking about some of their concerns, and asking for STI testing. So some of the things that our team does to reduce these barriers is that when we're working with community members around STI testing, or if someone's been diagnosed with an STI, we really try and be supportive and non-judgmental when working with folks. We have low barrier or no cost options for access to treatment for some of the most commonly reported STIs. And we also provide low barrier testing for folks that are disproportionately impacted by STIs in our community, and folks that have historically had maybe trouble accessing routine sexual health services. We also work with our healthcare providers and individuals that are diagnosed with STIs to ensure that folks have timely access to testing and treatment, and that they're at lower risk of reinfection in the future.
Seems like a lot.
Yeah, we're busy.
Yeah. Are there things that community members and partners could be helping when it comes to reducing some of those barriers?
Yeah, I think just normalizing STI testing as part of regular healthcare. You know, we get our blood pressure checked, we get other labs. STI testing is just a normal part of healthcare. And I think when folks are accessing STI testing, sexual health care, that providers are really approaching those conversations in a non-judgmental way and just making it part of their healthcare services. And I think also just thinking about the language we use when talking about STIs, we like to avoid things like dirty or clean when talking about
Right.
results. Like, it's just like any other infection. We need folks to just, get tested and treated just like any other bacterial infection they may have.
Yeah, I appreciate that discussion. It kind of helps us think about even how we talk about it within our own households or our own groups, and consider that as well. I like that. What should a person when should a person get tested for an STI, and what can they expect when they go in for testing?
So, STI testing frequency depends a lot on your own practices. So, if you're sexually active, we do recommend that everyone get tested at least once a year, and more frequently if you have new sexual partners or multiple partners, or maybe you have a partner who has multiple partners. So, some folks can get testing up to every 3 months, depending on kind of their own situation. And then obviously if someone's having symptoms that they're worried about, they should go in and get tested right away. So some of those things that we think about are things like abnormal discharge, changes in urination, such as pain or itching or discomfort with urination, sores, rashes, or blisters in the genitals or mouth area, and skin rashes is another thing that might indicate that you have an STI. So if you're having those things, always good to go in and see a provider and get testing as soon as you notice them. And then when you're going in for testing, you can expect a few different things. So your provider will probably ask you a few questions. They might ask you about sexual practices, any concerns you've been having, any potential exposures that you know about. Maybe a partner has said, hey, I went and got tested and I have chlamydia. It's a good idea to tell your provider that when you're going to see them so they can get you treatment as soon as possible. They're probably going to do a physical exam, which is totally normal, just making sure that they're not noticing anything that maybe you weren't able to see or maybe you missed. And then they're probably going to take a few different types of samples. So we recommend that folks get tested wherever they have sexual exposure. So that means we might do a throat swab, a rectal swab, a vaginal swab, in addition to a urine sample. Okay. And then we always want folks to also get their blood tested, because a urine sample or swabs don't test for everything. The only way to test for things like HIV and syphilis are through getting a blood test. So really important that you get both of those.
Yeah. Are there resources or services available in Spokane to help with the cost of these tests?
Yeah, there are. So we have a number of providers that work on sliding fee scales and work with patients to make sure that they can afford healthcare. So things like CHAS, Unify, and Planned Parenthood all offer those types of services, which is great. Insurance covers STI testing for most individuals. So if you have healthcare insurance, that's always a good option to use that and see your provider. And then there are some free online testing services where they send a kit to your house. You collect everything at home and send it off in the mail. So that's a good option if it's really hard to get to the doctor because of schedules and other commitments, maybe childcare issues, that kind of stuff.
Are some of those available at pharmacies too?
They are, yeah. So you can pick up an at-home test for HIV and for syphilis at a pharmacy and take that home and do a little blood collection at home and send it in the mail, and they'll get you your results. So it's pretty cool that we have those options. And then here at Spokane Regional Health District, we have very limited testing for some folks. So we always encourage people to call us, reach out, and see if that's something that might be available to them.
Great. Thank you so much. It's so much great information. And I hope that just having this conversation does help us get more comfortable with talking about STIs and helping people get treated, because a lot of these can be treated and can be cured even. So, you want to be able to get in and get help right off the bat. So thank you for coming in and talking to us. We have links in the chat to help direct you to the resources that Kirsten talked about today. And otherwise, we will see you next week.